Hello and welcome to Panorama. I'm Mark Glasgow, and coming up on our program tonight, do you have teeth problems, eye problems, maybe a torn ACL? Well, so might your pet. And that's what we're going to talk about tonight on Panorama as we talk about our four-legged friends in the animal kingdom. Joining us to do that is Dr. Mark Iacoprero from the Worcester Animal Clinic. And Mark, welcome to our program.
Thanks for having me.
And want to talk about that very thing, and that is the similarities between us and our pets. And in some cases, it's quite disturbing, and in other cases, not so much, but there are similarities.
Yeah, it's amazing, and it's amazing to a lot of my clients that don't have as much experience with pets as maybe some other people do that have had pets their whole lives, how similar a dog is to a person. And it sounds crazy, but a dog and a person are so similar from an anatomic standpoint that a lot of things that we do with a dog is the same that would be done with a person or with a person and a dog. And if you look at, obviously, besides them being on all fours, some of their joints having a little different angle, if you look at organs, liver, kidney, pancreas, spleen, all those things in their abdomen, just like you or I.
Wow.
And bladder, everything is the same. If you take a dog, or a cat for that matter, and stand them up on their rear feet, and you look at that dog, everything is about in the same place, the same design, with some slight differences.
Sure.
But it is identical to a person standing there if a dog or cat is standing there. And it takes time to understand that and realize that if you're not a person's had a lot of pets and been through a lot of medical situations, but heart's in the same place, lungs are doing the same thing, and all those organs are right where a person's would be if you stood that pet up.
Okay. Now, I don't think that means you should take your pet to your family physician, or will there soon be a pet wing at Worcester Hospital? But when it comes to the treatment then, are the treatments often the same?
A lot of the treatments are the same, from fractures or maybe ankle injuries, knee injuries, hip injuries. Some of the medical conditions are the same. Dogs and cats get less heart attacks than people do. A lot of the differences are just based on time.
Okay.
What I mean by that is, if a dog lives to be 15 years old, that's a really old dog.
Right.
Those dogs usually don't live long enough to have a heart attack.
Okay.
Now, they can have heart disease, but they get some different heart diseases than people do.
Okay.
But that's one of the differences then is time, because you have a person living anywhere from 60 to 100 years old, where a dog or cat's going to live anywhere from maybe 10 to 20 years old if we're really lucky. So some of the things are a little different just based on time.
Okay, that makes sense. Now, you talked about a lot of the internal organs are the same. What about other things? I mean, I said eye trouble, teeth trouble, all that as well?
All that is the same. There's some differences in eyes on just what they can see and what we can't see or can't see. There's some slight differences on their teeth, but very similar. Same with the ears. Nervous system, spinal cord, obviously their brain can do a little different things than what ours can, but you would be right more often if you compared things identically from a person to a dog. So the differences are there, but they're much more minor than how much the similarities are.
Right.
And on the medical aspect that you asked about, I think a lot of our medical treatments are identical to what is done in people, with a couple of exceptions. We don't have easy access to a MRI.
Okay.
And that makes a huge difference for some conditions.
We being the veterinarians.
Yeah.
Okay.
Yeah.
Okay.
As veterinarians, we don't have a really good access to the MRI or the CAT scan. It's not that it can't be done, but in the vast, vast majority of those cases, insurance isn't paying the bill.
Sure.
People are. And so it's not that I can't have a dog that, say, has a spinal problem and go get an MRI done. It's just that it's not done as often because that significant amount of money is not coming from the insurance company, it's coming from the client.
Right.
So I really think a big difference is MRIs and CT scans that we can't do as often, and also I think advanced neurosurgery, obviously, that we can't do. Again, not that it can't be done, but just from a financial standpoint, that's tough to ask.
Sure.
Also with that, when it comes to cancer, a lot of the treatments are the same.
Okay.
But we have to control what we do with cancer treatments a little differently than what human physicians do. And the reason is the pet can't understand what we're trying to do. Mm-hmm. We can't make them understand, look, you're going to be sick for 2 months.
Yeah.
You're going to have this issue or that issue, because they think, why are we doing all this? Where in a person, I can make you understand, look, there's going to be some hard times, but hopefully we'll get improvement at the end.
Yeah, having had the cancer thing 30 years ago, I can understand that, because it's difficult enough as a person to understand, hey, I feel okay, what you're giving me is making me sick.
Right.
I can imagine it from the pet's perspective.
Yeah, and that's a tough thing. Like dogs get lymphoma a lot, and lymphoma is one of our cancers that we can treat the best, just like in people. The problem is it's a lot of needle pokes, it's a lot of treatment, it's a lot of hospital time, and a lot of times those pets mentally just have trouble dealing with it because they think they're getting punished for whatever reason, when in fact you're trying to help them.
And for the pet owner watching that says, well, my pet is that important to me that I would do that, as a veterinarian, you're going to do what the pet owner wants, but it also comes down to a quality of life issue, I think, at that point.
Right, and that's tough because we work for two people. We work for the client, we work for the patient,
Yeah.
or try to, or should, and so we have to try to help the animal that we're dealing with, but also try to steer
Sure.
that client in the right direction. And I do think, a huge difference with what we do and what is done in human medicine is just how far should this treatment go.
Okay.
Because at some point they're suffering and maybe it's time to stop.
Right. Is there anything just completely different than completely off the charts the other way when it comes to animal versus
Not really.
Okay.
I mean, there are some medications that maybe they can't take that people can, or there's some obscure things like that. But if you go down the list of comparing human medicine to veterinary medicine, besides some of the limitations we talked about, it's very similar. Not counting some of the drugs, because there are a lot of drugs that people take that will kill a cat, will kill a dog. So I don't want to make it sound like holy cow, anything, because you give a cat a Tylenol, they're going to die.
Okay.
So there are some medical differences with medication. So don't treat your pet like yourself.
Yeah.
But really from an anatomical, physical situation and medical diseases that they get, they're very similar.
Yeah, and that's probably another point. I mean, we joke and tease about taking your pet to your family doctor, but as Mark just said, don't try to medicate at home or think, oh, well, I do this when I have this, I'll do it to my pet, because as Mark said, you could inadvertently do some very serious damage or even possibly kill your pet. So,
for sure. So
it's very
that's
important to
difference.
still talk to your veterinarian before you do anything. One of the other things that we've talked about before and is the fact that the pet can't talk. At least not yet. They'll come out with an app for it one of these days probably. But the pet cannot communicate to the doctor what's wrong, like we do when we go in. Well, my knee hurts, or I'm having trouble with my eye. The pet can withstand a high threshold of pain, as you guys have said many times, but it can't tell you what hurts. So that's probably one of the most difficult things about your job as a veterinarian, is to try to figure out what is wrong with this animal, unless it's obvious.
Yeah, and that's true, because we get that complaint a lot from our clients. Look, something is not right with this dog, and it's tough because there are so many things that'll make a dog not feel well, and some of those things aren't obvious. And when they can't say, look, my back hurts, or something's wrong in my belly, or my chest isn't right, it is sometimes tough to pinpoint. And I will say this, that's one of the reasons I think we do a lot more blood tests maybe than are done in the animal or in the human side of things, because boy, if you can't figure things out, and I've learned that the client knows better than me. If a client says, look, something's not right, they're right. It's just a matter of figuring it out. And sometimes that takes some more x-rays, some blood work, some of those things that maybe if the patient could talk, you wouldn't have to do all those things.
Okay. Did the veterinarians, let's say back in the 60s, 70s, did they know this as far as the physical similarities between people and pets when it comes to organs and teeth and things like that? Did they know that? Because as we've talked many times, I don't remember my grandfather taking his dog to the vet for things that we might take them to today. So did they know that, or was it just maybe the technology wasn't there, or how do you answer that?
They knew the similarities. There's no doubt about that.
Okay.
But what has changed, one is there's a lot more medical options now than there used to be. I mean, where veterinary medicine was 40 years ago compared to now is unbelievable.
Okay.
So that's part of it. The veterinarians always knew. They just were more limitations.
Okay.
The other part of that, though, too, is there were more limitations from the client part of it. Because, yeah, it was a society, a farming society. You know, your dog was kind of like your cow. It did what it did and it didn't. And then over time, those animals, certain animals, became more of a pet than a piece of property. So then what happened is the client demanded more, the veterinarian wanted to do more, and the medical part of it kind of caught up with them.
Okay.
So a lot of these drug companies, medical companies that were more focused in human medicine moved into what they could do with the veterinary market, because that market was expanding because of the client's desires to do more. It was more a client pushing. The veterinarian knew this all along. It's just there were limitations.
That's a very interesting point. I don't think I've ever heard anybody put it that way, but there was really very little emotional attachment between my grandfather and his dog. Now, maybe that wasn't true of all the dogs, but of the dogs he had during his lifetime, very few had that emotional bond. Whereas now, jumping ahead to even 10 years ago, 20 years ago, I think that's when it started, that they became family members.
Exactly.
They became kids.
Yes.
And that's probably no truer than it is today.
And there was, let's say 50 years ago, a lot of veterinarians focused on the farming industry, cows, horses, which is all great. But at that same time, as that market was there, people wanted more for their dogs and cats. And as that part expanded, veterinarians' knowledge expanded, and drug companies had to keep up with equipment. Some of the things we'll talk about, things that, now we do a knee surgery every week.
Okay.
There's, 40, 50 years ago, there weren't a lot of people doing knee surgeries because, one, the client didn't demand them. As the client wanted those things done, the veterinarian was always there to figure out, hey, this is what we need to do to keep up.
Okay. Now, looking 50 years from now, I'm sure you guys read the veterinary journals and things like that. Is there ever talk of any kind of a transplant issue that human beings could benefit from? I mean, I know you do in certain cases today with heart surgeons and things like that, but is there any talk that, somebody could survive on a dog's kidneys, for instance? Or
Well, a lot of that stuff, the knowledge is shared.
Okay.
The organs can't be shared because of how our immune systems are.
Okay.
So some of those things will never work going back and forth because it's hard enough to get a person to not reject a new kidney.
Okay.
It's very difficult to get an animal to not reject a new kidney you give from a dog or a cat.
Okay.
To go back and forth, the immune system would never allow that to happen. It would never. The knowledge is shared.
Okay.
But things on the inside of the body will never be shared because the immune system will not allow it.
Okay. Now, going against probably everything that PETA believes in and some of the other animal rights groups, is this